hybrid scanners, which we use for diagnosis? So, somebody?
The PET, for example, you mean the
SPECT-CT and PET-CT. Yeah.
PET.
Yeah, and why we told that they are hybrid devices?
Yeah.
What is the meaning of hybrid device?
Hybrid means in two ways, like it's using in two ways.
Because they consist of two devices,
Yeah.
PET and CT and SPECT and CT. PET, what means PET? It is abbreviation of positron emission tomography.
Yeah. And
it is functional method. It is nuclear medicine method. And CT, which is
computer tomography.
Computer tomography. And in one study, we obtain two images, functional nuclear medicine and structural from computer tomography. And then we fuse them. This is hybrid image. Do you understand that?
Yes, yes.
Yes. So we have two kinds of hybrid scanners, SPECT-CT and PET-CT. What is the difference between them? The difference is because SPECT-CT uses radiopharmaceuticals which emit gamma photons, as technetium, for example. And PET-CT what means? PET is abbreviation from positron emission tomography.
Yeah.
In these studies, we use radiopharmaceuticals which emit photons. That's why the abbreviation is positron emission tomography. So, which is the most commonly used radionuclide in SPECT-CT imaging? For different scintigraphies. The most commonly used radiopharmaceutical is technetium, 99M technetium. And what are the physical characteristics of technetium? Half-life and energy. Yes, half-life is 6 hours and energy is 140 kiloelectron volts. What is radiopharmaceutical? For one nuclear medicine study, we need radiopharmaceutical, which is proper for the study. And, yes?
Radionuclide emits radiation and clinical compounds?
Yes, two compounds. Radiopharmaceutical consists from two compounds. One compound is radionuclide, which emits radiation, and the other compound is KIT. It is finds the target organ which we will study. So for each scintigraphy, we need different radiopharmaceutical, which is proper for this study. Is it clear?
Yes, yes.
For thyroid scintigraphy, which radionuclide we use? And which radiopharmaceutical? Iodine, 131 iodine for thyroid scintigraphy. And for bone scan, we use 99M technetium MDP. Which is the most commonly used radiopharmaceutical for PET studies? Most commonly. Oh, it is 2-desoxyglucose. Is somebody hear me?
I am trying to follow.
No, nobody takes part.
Guys, open the microphones.
Okay, but I think that you have to learn the lectures and to know something. I asked you questions which I will ask on the exam. So you you have to read lectures and to learn them. It is enough for the exam, but you must learn lectures. There are only 3. So let's go on. Which is the main clinical indication for lung perfusion scintigraphy? Why we perform lung scintigraphy? In which occasions?
For embolism?
For pulmonary embolism. We search pulmonary embolism when there is clinical observation for pulmonary embolism. And what we see on perfusion, lung perfusion scintigraphy, when patient has pulmonary embolism. We see hypoperfusion in segmental pulmonary segments.
Professor, they are typing some answer, for example, Vagelis route here, the lower track uptake in the area of embolism. In the low tracer uptake, like we will see in the area of the embolism.
Yes. We see low trapping of the radiopharmaceutical in the segments which have pulmonary embolism, which are hypoperfused. And what are the indications for bone scintigraphy?
Tumor, maybe?
Bone scintigraphy is it is frequently used for bone metastasis. It is gold standard for visualization of bone metastasis. But in many cases, and there are many indications, because bone scan is functional image of skeleton, and each disease can be visualized with bone scan, because it has very high sensitivity. So it is used not only for bone metastasis, but in bone tumors, in orthopedics for low back pain differential diagnosis, in